Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hi, everybody. This is Dr. Mary Ann Pinkston, and this is The Better Life with Dr. Pinkston. And as always, I'm bringing you some great content, hopefully staying on the cutting edge of the news and the issues lately, and bringing in my favorite compounding pharmacist, Ray Solano from Cedar Park, Texas, up there close to Austin, and runs PDLABS, the compounding pharmacy that I use the most because it's a trusted, wonderful source. Ray runs a good program up there. Thank you, Ray. Hello, how are you?
I'm doing well today, right here in where I'm here in sunny Texas, and and you're in a beautiful part of the country. You're in Wyoming, right?
I'm actually up in Montana. So
Montana, that's right. That's right. You're in Montana. My fault.
Yeah, I travel back and forth, and I'm in Texas a lot and up here a lot. So go back and forth. But yeah, it is a nice, was 57 degrees when I got up this morning. And that ain't bad. I'll take it, right? 70s by the end of next week. So love it.
Right.
Well, and it's talking about staying on the cutting edge of some the latest topics and news and things like that. Thyroid has taken a little bit of a hit, and everybody loves thyroid. That is one of the things that when patients come in, it's their favorite topic because they think that is what's wrong, and that's all that's wrong. Just fix that and we're good. Many times it's involved, absolutely. In the 500-piece puzzle of the human body, it's one piece, but it is an important piece. And it took a hit lately on the news. So what is that all about? Do explain.
One of the things that we do know that we call, you understand the third rail of politics is Social Security. Well, the third rail of medicine is thyroid. Okay.
Thank
you. You don't touch thyroid in this area of medicine without hitting a buzzsaw. Because people are stabilized on a pharmaceutical, whatever their body gets used to, whatever is being taken, it comes to a homeostasis area because that HPA axis is so critical for balance.
Absolutely.
So one thing you don't want to do is upset people that are balanced. And people are balanced on whatever they're doing. And so unfortunately, when the federal government comes in and states that they're going to completely take away desiccated or natural thyroid, you have to say, my goodness, what in the world are they thinking? And so guess what? We still have a freedom in medicine. So the FDA came out with a surprise letter and sent a warning letter to manufacturers close to 12 days ago in a surprise and said that we are classifying this desiccated thyroid as a biological in the same category as HCG and many of these very difficult injectable drugs that are for many chronic and orphan drug statuses or difficult drugs.
Right.
And taking and misusing the classification so it requires a new drug application, a separate license, and fundamentally prevents compounding pharmacies from personalizing thyroid medication and manufacturers unable to put it in the small amounts and in dietary supplements.
Right.
And also manufacturers that make Armor Thyroid and some of the others, they have to reapply their license. So you're taking a drug that's used to be pennies on the dollar, and now it would be worth hundreds of dollars a month. So it was unfortunate. People just went nuts.
Yeah.
So the good thing is we didn't panic. We've seen this happen 3 years ago.
Over. Yeah. Oh my gosh.
And we just said, we're just going to sit back and get some popcorn and just watch.
Watch drama.
watched the drama, we doubled up on our volume, and we realized that this was not going to end well.
Right.
So, we have a very large political action group that we're on Capitol Hill in 2 weeks, and we welcomed this because this was a great segue to our meetings with influential members of Congress.
Right.
And guess what? We found out a couple of days ago, FDA Commissioner Markley found out what was going on. Seemed like the whisper ended up being a roar, and reversed it. And now they're going to take thyroid, put it on a path to become a drug.
Yes.
Without in the classification as a drug, to take the clinicals as a normal pharmaceutical. So reversed the ban. Yes. And went back to normalcy. So, the good thing is we still have a voice in medicine.
Thank God.
So everybody can breathe some relief. And I think this is an exciting time that people like yourself, your patients, your practitioners have a voice, because it got loud and clear. So we have somebody that's listening.
Yeah. And, it happened to a lot of the peptides. It happened to, it happens on and off to hormone replacement. I mean, it is just a solid attack. And, and our voices are getting heard more and more. I feel a tide turning, with Robert Kennedy and Junior and I just feel that tide beginning to turn. It's not perfect yet, but we're headed in the right direction. Let's see how long we can ride with this.
I think we've got it. It's kind of a honeymoon period, we think, because as soon as people go away for a couple of days, they come back. Yeah. Abby Vay had a new drug that was coming out for thyroid, and they needed to get rid of all the other inexpensive options. So that this is a very, very big conglomerate monopoly that's out there that it looks for expensive medications, restrict pharmaceuticals from you to make your choices, because you've got patients that have all different metabolic dysfunctionalities, and you need to be able to have a choice what works for them. And many times it's one of 9. Right. It's not just one, it's just whatever works for them.
Absolutely. And just to explain a little bit kind of thyroid, don't want to go too far, but our thyroid is a gland that sits in the base of our throat, and it puts out thyroid hormone. So to lessen the complexity, basically that is T4, what we call T4. And it has functions, but it doesn't have the function that we're looking for. That T4 has to be converted in the body to free T3. So you can look at your T4 and TSH levels that most doctors do, and they miss the boat because they're not checking the real functional, portion of it that we're looking for, the free T3. And that is what desiccated thyroid does. It gives you back that T3 with a little bit of the T4 to push your body to convert on its own. And so that is why we're focusing on this, because many people go get their thyroid checked. They have the list of symptoms. They get their TSH and T4 checked. Nothing wrong. All those levels are normal. And they're told it's not their thyroid. And really, it still is. And we can check free T3 and balance that out. So hope I explained that loosely enough to kind of push us forward. And so you're right. And many of the pharmaceuticals are the T4. Okay. Hate naming names and bashing. And I try not to do those things, but and if it walks like a duck, it's a duck. And so, the T4s are the synthetics and the ones that are mostly pharmaceutical driven. And so, the compounding world and the more natural world tends to get bashed. We want science to follow, what we do. And we do have lots of wonderful science. But again, when it gets to that government level up there, it tends to get squashed. And that's exactly what happens. So for a little background there, like many other medications.
That's right. There's a number of medications. There was ivermectin was considered the scourge of the earth, and they ignored the science. They ignored the research. There's one of the most celebrated pharmaceuticals in the history of drugs, and it was originally cultured from a soil species. So unfortunately, we go into this over and over again, and that simple pharmaceuticals that are inexpensive and cheap end up being put in as a secondary option as opposed to a primary. But it's unfortunate that the simple solutions of economical drugs are discarded.
Yes.
And so that's what we do. We take drugs and repurpose them into different dosage forms, like low-dose naltrexone.
Yep.
A low dose is much different than it is in a high dose.
Right.
So we're able to take unique pharmaceuticals like even testosterone or botanicals and envelope them in a delivery system that lower doses get absorbed and they get tremendous effects.
Absolutely.
So, we really, it's important to have that innovativeness in pharmacy, working with practitioners like yourself, and, to be able to segue into, the choices. And I understand that you're putting together an unbelievable platform for patients that are really going to open this up.
Yes.
And that's what we want to support you and what you're doing.
Thank you. Yeah. And so on that note, and this will be the first time I speak of it, honestly, publicly, we are starting in Texas and then going to branch out, to other states. And that is our New Bloom. So NUBLOOM, New Bloom. And it is an integrative, and this will kind of get us into our next topic. So it is an integrative platform of, customized, personalized medical care, right? Where we, when people go on to the internet and they're looking for weight loss medications, they're looking for sexual health medications, looking for solutions for themselves, hair loss, all these things. Right. They, find a place, take a little checklist. It goes into the system of algorithms and protocols. Somebody gets on the phone with them for a couple minutes. Right. Sends them a prescription, and then no monitoring, nothing. And people don't realize when I mentioned at the beginning, 500-piece puzzle that the body is, you need to pay attention to all 500 pieces, and just a simple little checklist and no doctor or provider behind it is not correct. So it's not correct in that it's dangerous. You need to be monitored. You need to be guided. I know the internet has a lot of information. People research. I applaud that. You need to be an advocate for yourself, but you need a customized plan. You need somebody to look at the head to toe, the whole picture, and make sure that you are following the guidelines and things that are out there that are good for you. Now, that is where I kind of want to spend some of the next topic too, is just to say that, you go into the system of protocols, and we spoke, actually, this is interesting. We spoke with a company to try to perfect our system. We have a checklist also, but that is just to put you in the right position with the right provider, that you will spend an hour with on your first visit, and then meet with a coach weekly, and then meet with your provider once a month. And this is beautiful. This is something people do not get anymore. We met with a company to try to streamline our protocol, not reinvent the wheel. It takes a lot of time and money to put all this together. And so we tried to do that. And they are at the basis of all those larger companies out there that are just, sending prescriptions out without much medical care behind them. They're following the rules, but the rules tend to bend and go a different direction that's a little questionable. And they're at the basis of that. So we learned a lot about the background of these companies. And let me tell you, it is a moneymaker. It is a moneymaker, and that's all it's for, is making money. It has no advocacy for patients whatsoever.
And it's really shameful because it's expensive.
Yes.
They're spending a lot of money, and they got a lot of splash and influencers, and we just want to we shake our head and scratch and go, my goodness, there's so many other value choices. Absolutely. But it's difficult. I just don't understand the motivation. Right. It seems to be more something they can brag about as to but the results matter. So we are really excited that you're putting a seasoned group of professionals together, and so we're willing to get behind you.
Thank you. I appreciate that, like you always do. So that is always a great thing. You're our go-to. And so in doing that, we hope to catch those who have already gone through the system of just, hand a prescription, things didn't work out right, and, catch people as they fall through those cracks. That'll be something that I think is a big grab on my heart, is just making sure that we kind of return back to the old days of medicine where you actually have a relationship with your physician or your provider. Again, there's lots of nurse practitioners, physician assistants and whatnot, nurses and coaches. And so your provider, we want to make sure you have a relationship again. One of the things that is important about it too is the team that we put together. So it's not just diet. It's not just prescriptions. It's not just supplements. It's not just fitness. It's not mindset. We're dealing with past traumas or eating disorders, or, a mindset about how food works with your body and how to deal with stress in your life. It's not just about correcting sleep. And, listen, that's a laundry list of things, and people needed in their spectrum of, their authority and on what they know, then that is what we cover, the whole gamut. And I think that's very different than what a lot of other places are doing, just trying to load on one provider or one coach, all of those aspects. We have the whole team, and that is the difference.
That's exciting.
It's exciting, isn't it?
Oh, you are going to make a huge difference. Now, people are, once the word gets out and once it goes live,
yes,
we are, it's some of the most simple choices. Yeah. Unfortunately, the things that people say, well, they don't have any money to do this. Well, look what they do, what they eat. Look what their lifestyle is, what they do on a daily basis, Monday through Friday. It's unbelievable.
It is. And even Saturday and Sunday when they go out to and socialize, I don't want to say go out and party, but, go out and socialize. How much money is spent on things that they should not be doing, and just divert it to what they should be doing? You're not out any more money than anybody else. It is actually shocking is when you go up to these events and the things you used to be able to be. So if you're a social drinker or at an event, the fees and the pricing that is pays for these items, and then you look at it and you go, well, wait a minute, for $50, you could afford something that's going to could change your life. Absolutely.
But people would rather spend the $50 on something else that's kind of doesn't really do anything to your health.
Like I mentioned, parking. You go to an event downtown and it's $35 now to park, and I can buy a Wagyu steak from Snake River Farms for $35 now. Are you serious? I mean, really, yeah, it's in it. We make a choice. We make a choice, but people are doing better. They're understanding it. They're getting it and making choices. And I think we have the semaglutide, tirzepatide, the weight loss phenomena here. And I think that helped to push us to understand it better, or help, the public understand it better. And of course, with my story behind me, being 300 pounds, I've said it over and over on the show. Everybody's tired, I'm sure of it, but being 300 pounds and having gone through it. Now, you can go to a weight loss doctor or weight loss clinic, and get great advice. And again, not to bash anybody else, but you take a physician who's actually been through it and understands the psychology of it and how difficult it is and challenging, and, put me in the seat to try to help somebody else. I'm so excited about that. That is it's priceless.
We got a lot of choices today to get people to get their weight loss, their weight under control. If nothing else, nothing else to get them started. There's never been a time for something to get people started as we see this. So
absolutely. Well, and it is about to launch. I mean, we are on the heels. I'm hoping by this time next week, I've already seen patients. And so it is mynewbloom.com. I'll throw it out there, and we're going to start getting inundated now. So mynewbloom.com. And it is not running yet, but it will be. And it's a matter of days now. I've got my business partner, Jennifer, who is really great success in the past with the businesses. We are going to do some wonderful things out there. And thank you, Ray, for your support. So we probably ought to take a quick commercial break. So tell me, though, first, where can people find you?
Well, check out our website, PDLABSRX.com. That's PDLABSRX.com. And you'll find out all the information that we provide for full service pharmacy and all of our leading edge formulas. So we're very open to phone calls, 888-909-0110. And I still answer the phone, and we work with practitioners nationwide and answer a lot of questions.
You sure do. And so we have some previous shows. You can go to drpbetterlife.com and find all the links to the different podcast platforms and our previous shows, and also to find PD Labs on there. I've got a quick link, and it goes straight to them. So when we get back, we're going to talk a little bit about thyroid again, because I have a question for you. So we'll take a short break. Be right back.
Okay.
Hi, this is pharmacist Ray Solano with your Healthy Choices Minute, sponsored by PD Labs Pharmacy. Freedom to choose your physicians and medicine is a practice celebrated in this country forever. Today, the public has spoken, and the FDA reversed its removal of natural thyroid as a proven pharmaceutical. Yes, victory for patients everywhere currently on thyroid medication. PD Labs Pharmacy is dedicated to patients' choice for personalized medicine shown to improve the quality of life and reverse many chronic diseases like mold, Lyme, cognitive decline, and of course, rebalance your hormones. PD Labs is a nationally licensed compounding pharmacy, and we serve patients everywhere. Check out our website, pdlabsrx.com, or call us today at 888-909-0110 and mention this ad, and we'll give you $25 toward your discount of natural thyroid medication. And our website is pdlabsrx.com. Call us at 888-909-0110. Remember, you have a choice in healthcare.
Welcome back, everybody. I'm Dr. Marianne Pinkston and The Better Life, here with Ray Solano from up in Cedar Park, Texas, PD Labs, my favorite compounding pharmacist I've been working with for many, many years now. Ray, when I alluded to the fact that I wanted to talk about thyroid again for just a few minutes, because I think this is very important. There are, in the desiccated thyroid world, desiccated thyroid, first of all, what does desiccated mean? And what is, the natural, explain the difference between natural and synthetics, but, also too, why do we, prefer one over the other, again, with, some autoimmune disorders and there's a lot of different choices. So we have to be particular about which one we're choosing and which situation we're using them in. So maybe you can explain some of that.
Well, if you just take back a segment back to history, before there was synthetic pharmaceuticals, the only thing available for physicians and naturopath physicians and homeopaths is, homeopathy was the foundation of most medicines, cures and it works, and it still works today. And then naturopath physicians and chiropractors, they've been using glandulars medications for centuries, that they take animal glandulars and be able to refine them and be able to take those active hormones in there to be able to cure many, many conditions, and thyroid was the first one. It was made from porcine or pig's thyroid, has a similar structure. T3 to T4 levels are it's 4-to-1, and porcine is 4-to-1. 3-to-1. So it's similar structure, but it also has these other cofactors. Mm-hmm. And the other cofactors are selenium and T1 and T7 and T3. So there's so many other cofactors that seem to influence thyroid function. Right. So in balance with the adrenal and hypothalamus and other gut issues, it's a foundational support to raise people's thyroid levels. And many times people have no thyroid because of premature removal of it for whatever reason. But what we find is taking this it works very well. It's very inexpensive. And then all of a sudden the government got involved and said that the level of T3 was varied from lot to lot, and they weren't able to standardize it. So they took it off the market, or they made it very, 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 very restrictive. And they wanted to try to take it off as a pharmaceutical when Synthroid came out in the 40s. Because that's T4, and there's been this war against thyroid ever since.
Absolutely. And like anything, right? Used for centuries, safe, effective, and then enter. Yeah. And so we know.
And so now thyroid gets expensive. Armor Thyroid now is, some prescriptions $100, $150. Used to be the most inexpensive drug was $7.
Right.
So the inflation in pharmaceuticals is astronomical, and so the desiccated thyroid have some variations from lot to lot, but these pharmaceutical companies are been able to standardize this. That is quite remarkable. So,
absolutely. And I might add too, Ray, and I hate to interrupt you, but when they make generics now of other medications that are available from the pharmaceutical side, those have up to 30% difference in variability in their dosing. So how can we attack the natural side for less variability than what can be in the generic area?
And we try in our pharmacy to be within 5%. We're allowed 10% variance. 5% you can do this with, or some people you could take synthetic T3 and mix it with T4 and personalized prescription. That will work. So there's lots of different choices, but we want to give the practitioner the choice to put the piece of the puzzle back, what's best for that patient.
Absolutely.
And as opposed to one size fits all. So that's the reason why we want to make sure that we definitely have choices. And it looks like we will.
Good. Thank God for that, because I'm on it. And that is because of all the stressors in life, my adrenal glands. So here's another, tidbit for patients to understand, or people to understand that, with your stressors, when your adrenal glands, your cortisol and are in disarray, that interferes with that conversion I spoke about earlier from T4 to free T3. And so you can have normal thyroid function, but very little free T3 because of just, ongoing stress and cortisol and adrenal dysfunction. You can fix that. That is fixable. It takes a while. It is a process. And then you can come off the medication, different from somebody who has no thyroid function, either removed or it stopped, working prematurely, and they have to be on medication. So many people are afraid, and this is a myth, that, once I go on medication, I'll never be able to stop. In the situation of, free T3, that is something that if we can fix the underlying root cause, you can come off medication. I've done it with patients many, many times. So don't be afraid of it. Don't be afraid, Yeah, don't be afraid. I think that's the main thing. So, well, good. Well, Ray, this has been incredibly enlightening. As always, thank you for all the good information, the science, evidence-based information, and letting us know how reliable and wonderful you are there. Absolutely.
Well, we appreciate what you're doing, and we look forward to any of your listeners for your podcast. Give us a call. We'd be happy to help them out.
Absolutely. Give that information again for us, Ray.
Check out our website. It's pdlabsrx.com, pdlabsrx.com. And the phone number is 888-909-0110. And mention that you mentioned this podcast, okay? Yes. And we're going to give them a $25 victory discount on their thyroid medication. How's that?
I think that's wonderful. A victory. Yeah. V for victory. There you go. Victory. Thank you. Thank you for being so good to everybody. And yes, you can find all of our previous shows at drpbetterlife.com, as well as all of my shows. Been doing this over 3 years now and almost 300 shows. So this has been going well. And I appreciate everybody listening and watching. Really do.
Check out our podcast, Dr. Talks.
Yes.
Healthy Choices on Dr. Talks podcast. And you'll find some of the most interesting people that we've interviewed and health tips as well.
Absolutely. Please. I'm so glad you dropped that in there. Absolutely. And I'll put that on the website too. We need to. Awesome. Guys, I hope everybody has a great week. Please take care of each other out there, and we'll see you soon next time.
Okay. Thank you.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.